Hi, everyone. See some people are joining still. Hello, hello. Hi, Leah.
Hi.
Hi, Katie.
Hi.
See some familiar faces, some new faces. Nice to see you all. All right, so we have an hour together, and we're doing something a little bit different tonight. So many of you know the 9:30 call has this sort of balance between guest speakers and the updates from the field kind of open forum. So what we wanted to do was kind of bring that format to the 9:30 call at night as well. So we're super excited to have sort of 4 different people here. Some from the Boston Opportunity, some from the City of Boston, family childcare provider, shared services at the United Way, to talk about a new early education workforce report that has come out. And I think they'd love to get your all's perspective on it and to have a conversation around that. And if there's any questions, we'll have time for that at the end. And then we'll have sort of the last, half an hour or so to go into the typical kind of updates from the field open forum. So with that, I'm going to turn it over to our 4 presenters. I don't know who wants to go first, but Melinda, Paula, Ayesha, I think I saw Rosile join a minute ago. So if one of you just wants to kick us off, and we always start the 9:30 call in the morning with the question of who are you and how did you come to be in your current role? So if you want to give us a little bit of a background on who you all are, that would be great.
I'll jump in just to get us moving. It's such a pleasure to be here. My name's Ayesha Cammaerts, and I'm the Executive Director of the Boston Opportunity Agenda. And just so grateful for your time and interest in this report that really is all about all of you and the experts that you are in early childhood education. The Boston Opportunity Agenda is Boston's Cradle to Career initiative. We work with the City of Boston, with Boston Public Schools, with philanthropy, but most importantly, with community leaders. So that's parents, teachers, educators, providers, and you all are the educators in that. And we are just so proud to continuously be with you. We have a collaborative of close to 200 members, the Birth to 8 collaborative that many folks from the 9:30 call are a part of in that community. And we really aim to learn with and from the community so that we can identify the gaps in our systems that we need to really work on to improve. And you all are the ones that know about the solutions and understand the challenges. So when we do this research, we really aim to make sure we can learn with you. And that's really what tonight is all about. And that's how I come to this work. I was a community health worker. I am a mother of a 6 and a 9-year-old. I come from community health and health education. And so being in this space is just a blessing. And I'll turn it over to Melinda. Paula?
I'll go. Hi, everybody. I'm Melinda Weber. I know most of you. I'm super grateful for that. Just a funny story. We were I was at a UPK meeting with Paula and some of the Boston team, and we were talking about our UPK family childcare educators and how we had a meeting and we learned some new things. And I said, well, I've known them for 4 years. And they were like, what? You've known them for 4 years? And I said, well, it's been 4 years since we started our first business training. And many of the people on that call and on this call have taken those classes with us. So I'm super grateful for that. I lead our shared services initiative at United Way, which is our family childcare support initiatives. So let's see, I came to the work. I was an investment analyst in high tech. My mom got ill. Well, no, that wasn't first. Then I had my kids and I loved to watch them learn. And so I went through a series of adventures, teaching, going back to school, and running centers. And then my mom got sick and I was looking for a little bit less time and happened to be connected to this shared services initiative. And I loved the business lens because of my background. And I too love the people in this field. So I am just joyful every day to be able to support you. So thank you for having me. I'll turn it over to my friend Paula.
Hi, everyone. I'm Paula Gaviria. I work in the Office of Early Childhood in the City of Boston. I'm the Childcare Program Director. And I'm a psychologist so my bachelor is in psychology, but I'm originally from Mexico, where I worked with children in my private practice. I have a master's in psychoanalysis, and I started working in prison with women who are incarcerated and live with their young children up to the age of 3, and developing just workshops for them to provide the best developmental and early childhood techniques. And that's how I changed my career path into public policy, because I saw that I could have a larger impact on those young children and families and care providers that I was actually trying to support. So now I've been in the city of Boston for 2 years, a bit more, and I'm happy to be here. I know many of the family childcare providers in Boston, because it's really the work I've been doing, just supporting aspiring current on how to sustain, expand their business, and you'll see, and how to make this amazing job a good job for everyone in the field. So I'll pass it to Rosile.
Hello, everyone. My name is Rosile Moreta. I'm an owner and educator in childcare, family childcare in Hyde Park area. I have a bachelor degree in business administration, but as soon as I get pregnant, I have my first child, I said I need more time for my kids. And in my background in my country, I'm from Dominican Republic. I used to work with children. My mom was a teacher, and my dad was a government congressman, and we always work with children's. So I love children's. I love to work with the community. I love to help. This is the opportunity that we need to do to, as a family child care, advocate for what we need and have a better job. Thank you.
Still muted. I was gonna say, thank you all so much. I've known many of you for years now, and I always feel like I learn something new every time that we ask that question. So thank you all for sharing. And Paula, I know you were gonna share some slides, so you should be good to go, but let me know if you have any trouble pulling that up.
While Paula is pulling up the slides, I'll start to just give you a little framing. This is a report that we did in partnership with our colleagues, data experts from the community, from our Birth to 8 Collaborative Data Committee, and really in partnership with the Office of Early Childhood. And it was a survey that we fielded across the states and across the whole state. And we really zoomed in the report on what we found here in Boston. And Paula's going to share a lot of really rich data, and probably will go a little quickly, but this is also, and that's just because we have so much to share. So remember, this is being recorded. You will be able to access it, and you can certainly chime in and ask questions. We will have time for questions and answers. Some of the data and the information is a little challenging to hear, because we know that the workforce, it's not an easy job, right? To be a childcare provider, to be an educator right now. And so we reflect on that. And like Paula said, we're looking to really think about how to make this a good job, and to learn how you all are doing that and what is working, and also to reflect on how to make the system better. And so I'm just excited to be with you all. Paula, I think your screen is showing, I'm not seeing actually your slides. Is everyone seeing them?
I'm seeing the same thing, so maybe just try sharing it again, Paula, and see
Let's see.
if that works.
Can you see my slides or no?
It
You
says,
just let me start sharing, but not sharing nothing.
yeah.
You want me to try, Paula? I think I might have them up.
Wait, let's see. I'm going to.
As Amy says, this is always the hardest part.
Oh my gosh.
I have a good friend that says it's the most exciting part of his day. It's when he tries to share his screen.
It's the sharing sound that always gets me. Whenever I'm playing something with music in it.
Does it work now?
There we go.
There
Now
we
it's there. Very good.
Amazing. Okay. So I'll start to be mindful of everyone's time because I think the conversation is what I'm more excited about. As Ayesha mentioned, the data committee, there's a lot of people there. You probably all know Titus, he's part of the data committee. Okay, so this report, well, this survey was created because early educators as yourselves are the keystone of the early education and care ecosystem, but I would argue that of our whole ecosystem. So you are the equivalent of a coral reef in the sea. Without early educators, many of the things that we have today would collapse. So people could not go to work. We saw how many parents experienced that during the COVID-19 pandemic. They were like, "Ah, I don't understand how people can do this. I'm going crazy and it's been 2 days." So we want to preserve early educators to preserve the whole ecosystem. And to preserve you all, we need to understand those factors that are impacting the workforce and what we can do to provide fair and just and a high quality system of supports and opportunities for early educators so you can provide the highest quality of early education. So as Ayesha mentioned, this was a survey that went out to the whole state of Massachusetts. To design the survey, we spoke, and by me, I was still not here. I contributed to other parts, but we spoke to stakeholders, policymakers, researchers, funders, directors, and systems, reviewed existing surveys, and translated the survey into 7 different languages, and the distribution went out in various ways. Shared services, the early education and care department, our office, we shared in the 9:30 call, and we got a total of 653 responses, and over half of them were from early educators in Boston. So what did we find? We found that, and this is Boston, but it was similar in the rest of the state, the early education and care workforce is retiring without being replaced. When it came to family child care educators, only 1% of the respondents say they were between the ages of 18 and 29. Almost half were 40 years or older. This tells us that we need strategies to attract and retain young talent and provide the financial and educational support that they need to remain in the field and become family childcare educators like those that are retiring currently. As I mentioned before, throughout the report, we use this idea of a good job that is developed by the Aspen Institute. They say that good jobs attract and retain a workforce. So what is a good job? And you'll see that a good job has several different areas. The Aspen Institute identified 3 of them. The first one being equity, respect, and voice. So practices from the systems that support, that are transparent and enable accountability, support a sense of belonging and purpose, and address discrimination whenever it comes up. And for this area, we focused on the demographics of our respondents. So from the Boston sample, we had a more diverse workforce, with 36% identifying as white, 28% as other. And for those that identified as other, most of them also identified as Hispanic Latino. 26% as Black African American, and 9% as Asian Pacific Islanders. In the rest of the state, we see that most of the workforce identified as white, 90%, 6% identified as other, 4% identified as Black, and almost 1% as Asian Pacific Islanders. Ethnicity, we see something similar. Almost half of our Boston respondents identified as Hispanic Latino, compared to 7% in the rest of Massachusetts. And the individuals that identified as Hispanic Latino varied depending on the workforce setting and role. So 17% of directors and centers, 20% of teachers and centers, and 74% of family childcare educators identified as Hispanic Latino. So we see that there's differences in the role and setting. We also asked about language, and overall, family childcare educators are more likely than center-based teachers and directors to have a non-English primary language, which they speak at home. So we see that 42% of family childcare educators. And why is this important? Because when we're thinking about retaining and having more individuals join the workforce, we want to give them the tools and the education they need to provide the highest quality of early education and care. And it is easier for some individuals to get this education in their own language than in English if it's the second language. So we are also focused on identifying those higher education institutions that where most of our whose English was the second language, had attended to get their degrees or certificates. And we see that Urban College of Boston, Bunker Hill Community College, and Childcare Institute are 3 institutions out of the 10 with the highest attendance that have education for non-English speakers. Having educators that reflect the communities that they work with, it can be a protective factor with successful learning outcomes for children. So if in a city like Boston, we have many children that come from Haiti, Colombia, China, having educators that can speak the language and have learned and acquired skills in their own language, teach these children, can be a protective factor. So we want to encourage a diverse workforce. And here is an example of Urban College, who offers the CDA Plus and the teacher credentialing programs in Spanish, Mandarin, Portuguese, and English, but also provides wraparound services for educators that need supports to learn. So whether it's a computer, in-person and Zoom training, and English as a second language courses. Another part of a good job is economic stability. And here we will go into wages. We all know that the wages are not great. And what we found from our data is that wages have limited association with years of experience, educational level, and career advancement. But I want to pause here because maybe when you see the blue, the light blue, that is for family childcare educators, compared to the years in the field, so less than 5 years, 6 to 10, you can also see an orange dotted line. The orange dotted line shows you the educators that are earning the highest and the lowest pay per hour. So it is possible to earn a higher pay than the average. We need to find ways to advocate for that and to move all our educators to earn a wage that is representative of their years of experience, their education level, the hours they are putting in, and to promote career advancement. With family childcare educators, another thing that we see is that when they're serving low-income neighborhoods, sometimes raising tuition is not even an option because they know they wouldn't be able to serve the families most in need because they can't afford it. So it's as if we were punishing those that are serving the families most in need. United Way, shout out to Melinda, they have some work around how we can think about wages through the business training and the tech and marketing training. This is available in Boston, but correct me if I'm wrong, Melinda, it's also available through EEC and other parts of the state. and through neighborhood villages. See?
Now it's UMass Boston instead of neighborhood villages. EEC contracts with UMass Boston Strong Start. And that's where we go to enroll, and they provide the business training statewide. Tech and marketing still just in Boston.
Perfect. Well, let's find ways to expand because it's been wonderful. Another part of economic stability is benefits. So what we found from the sample of our survey is that 24% of family childcare educators have workplace benefits. It's a low number, and it's probably tied to being a small business. So you're your own employer, your own employee, it can become difficult to have workforce benefits because many times you have to pay for them yourself. A separate question around benefits was to rank by importance those that you would like to have or you had but thought that were more important. Number one, health insurance, followed by paid leave, then sick time, vacation time, tuition and professional development reimbursement, and access to paid professional development. What this tells us is that it's not that tuition and professional development are not important, but you can't really focus on getting more education if you're not at ease with, oh, I could actually take time off if I get sick, or if I'm tired, or if I want to go back home on a vacation. So they're all important, but it's really important to have health insurance and time off. We discovered that there are benefits options for family childcare educators out there. They're all available on the Shared Services of Massachusetts web platform, and they go from dental and vision insurance, docs by phone, telemedicine that is very similar to docs by phone, and human resources on demand. So these are all wonderful resources that you can access through the Shared Services of Massachusetts web platform, and they're affordable too. A third part of a good jobs is economic mobility, and this focuses on pathways and training and development opportunities. So, and in the report, you'll see we have these very weird plots that I always call slanky, but are sanky. I don't know. What we found that is the really important thing is that we need increased support and incentives for assistants or volunteers to continue building a career in the field. And we also need to increase professional development for the educators, both in business practices, because you are a small business, and in early childhood development, because that is your passion and you're working with children and you want to be the best at it, and we should be able to provide those training opportunities. And create pathways and opportunities for family childcare providers that are interested in opening a center. In the past year, I've heard this come up several times, and I know family childcare educators in Boston that have gone to do it. So we want to give you the resources to, if you're interested, to do it. And create leadership opportunities for educators to share knowledge and experience with other educators, advocates, and policymakers. The 930 call is the best place to do that, but also having mentoring, whether it's via shared services or in a system, or creating spaces where family childcare educators can come together and learn from each other. So an example of a pathway that we've created in Boston for family childcare educators is this one, where it's first the interest in becoming an educator, and we provide the support in getting licensing. Then after you get your license, the business training to acquire those skills to manage and sustain a small business. And then go into tech and marketing outreach, how to enroll more families, because it's part of having a successful family childcare business. And then we dive into the early education development part with the ASQ drive, so the Ages and Stages questionnaire. We've partnered with the Boston Public Health Commission to have training on physical activity and nutrition practices for children, but also for the educators themselves. And as I mentioned before, providing support, whether it's economic or access in language, in wraparound services to get a CDA, an associate's, a bachelor's, a master's for free. And in Boston, it's the first time that we've expanded universal pre-kinder to include family childcare. And the last piece of this roadmap is, are you interested in maybe opening a center? Let us help in the ways we can. So this is an example of a pathway, but the state is also opening pathways. So the business training, as Melinda mentioned, with UMass, and the degrees and certificates through the career pathways program. We came up with some recommendations, such as increase long-term funding to support fair and just high-quality early education and care systems. Make policies that outline a clear career pathway detailing certifications, degrees, licensing, changes in licensing requirements, and apprenticeships, if that is something that is of interest. Track information. So collect as much information as we can have to know more about your well-being. Not only about the populations you're working with and the number of children, but how are you actually doing? Do you have access to benefits? Are you making a living wage? Or all these things are important for us to support policies and programming. And increase advocacy for federal investments. Because really we need federal investments to have an actual impact on wages and support the early education and care system. That is it for me. I want to invite Melinda and Rosile and everyone and to have a conversation about these findings, because I guess many of them come to no surprise, but it's important to have a space where we can discuss the findings. So thank you very much. And we will share the report link. You can download it for free and look at the Sankey plot and all those other tables and graphs that we have.
Thank you, Paula. Melinda or Rosie, do you want to add anything else before we jump into questions, or do you want me to start kind of facilitating that process a little bit?
Rosile, do you have anything? I'd love to hear from.
I just gonna say there is a lot of resources. We just need to look for it. Church services in Boston City are doing a lot for us as a family educators. So just gonna raise our voice and ask what we need. So this is the only way that they can help us. So if there is any questions,
Thanks, Rosalie.
You're
All right, so Neri, do we want to stop the recording and then we can jump into some question and answer and discussion piece?